Hi, so I did my case study on a patient that had Legionnaires disease. So first we're going to talk about the pathology, which is Legionnaires disease. So Legionnaires disease is a type of pneumonia caused by Legionella bacteria. Legionella bacteria comes from man-made water system, which includes sinks, faucets, shower heads, hot tubs, etc. So when these man-made water systems aren't cleansed and maintained properly, they can grow bacteria, and this bacteria can spread into the water and rise into droplets that us humans inhale. So this bacteria would be Legionnaire's disease bacteria, which is what grows in these man-made water systems. And this is how we get infected, is by breathing the droplets in. Symptoms for this disease include coughing, shortness of breath, fever, muscle aches, headaches, nausea, diarrhea, and confusion. Life-threatening symptoms include lung failure. So now we're going to talk about the patient history. So the patient, she came into Broward General Hospital. This is a trauma hospital. She came in on January 20th. It was a female patient. She was 38 years old. The symptoms she had were shortness of breath, cough, fever, and extreme chest pain. Her pain level was an 8 out of 10. The symptoms began 2 weeks ago, but did worsen within the last 3 days. When asked of any prior illnesses, she stated she was diagnosed with Legionnaire's disease about 1.5 years ago. When asked of any medications, she stated she was on an antibiotic called fluoroquinolones, which is the main treatment that is given for somebody with Legionnaire's disease. So now we're going to talk about the orders. So the exam that the doctor ordered was a 1-view portable chest x-ray. Now, the reason for it being a portable chest x-ray is because the patient was in a severe condition when she came in. So they did place her on an ET tube to help her breathing. They placed her on CV lines, and they also placed her on a feeding tube. So because she had all these tubes in her, we have to do it as a portable x-ray. And he only asked for 1 view, which was an AP view. The reason for this x-ray that the doctor stated, the reason was to examine lungs and to compare to an x-ray that this patient had taken 1 year prior while she had Legionnaire's disease. So now we're going to talk about the chest x-ray itself. So again, this was an AP portable chest x-ray exam. So when we got there to the patient's room, we made sure that she was prepped. We made sure she had no clothing from the waist up, made sure she had no metal, no jewelry in the way, and we did make sure she had a gown, so she was covered. Once we made sure the patient was prepped, we then started with the portable machine. With the portable machine, you have to select the grid sizes according to the patient's size. So the patient was about a medium size, so we selected the medium size grid, and then we selected chest x-ray. Once you select chest x-ray, it automatically says the KVP and the MAs. So the KVP was set to 110 KVP and 2 MAs. Once we set this all up, we then placed the cassette behind the patient, which the patient was about semi-erect. Since she wasn't able to move, we just did the x-ray semi-erect. We asked her to just lift up slightly. We placed the cassette behind her. We made sure that she was centered properly in the middle of the cassette. Once we made sure she was properly centered, we then tried to position her. Unfortunately, she wasn't able to do the normal position for a chest x-ray. She wasn't able to roll her shoulders forward in the bed. So we just had her move her arms to the side and away from the lung field. Once we positioned her, we then centered the tube to T7. And then after we centered the tube, we gave her the breathing instructions. We asked her to breathe in, breathe out, then breathe in and hold that second inspiration. And that's when we took the exposure. So now this is the x-ray that was taken with the portable. So now we're going to do an image evaluation on this x-ray. So in this x-ray, the patient was semi-erect. Her hands were away from the lung field. Unfortunately, she wasn't able to roll her shoulders forward, but that's okay. We did the best that we could according to her condition. The CR was correct because it shows the apex of both the lungs. These are the apexes, and it shows the costophrenic angles down here. So as you can see, we centered it correctly because they're both included in the image. Also, the marker was included in this x-ray, but unfortunately we did have to crop it out because the x-ray did include some patient information on the side, so we have to crop it out. But this is the left side right here, and this is the right side. Again, this is the left side, this is the right side. Okay, and also in this image, there is opacity present. Opacity is white areas, whiter areas. All this white stuff right here in the x-ray is opacity. As you can see, there is more opacity in the right lung as opposed to the left lung. And this white areas can also indicate that there's fluid in the lungs. So that's also very important. So now we're going to talk about the radiologist's report. So the radiologist reported that there was pleural effusion in the x-ray. He stated that there was improved opacities in the left lung. There was no pneumothorax, and the lines, tubes, and the heart size were stable. So again, this is the image that I added right here that was taken a year ago. And then this is the current image right here. So like I stated, he did want to compare this x-ray to the x-ray that was taken a year ago. Again, this is the left side, this is the right side. We have to crop it out for patient information. This is the left side, this is the right side. So he stated that there was improved opacities in the, opacities or white in the left lung. So a year ago, you see all this white right here, which is all the fluid in the lungs. And then you see right here that it improved greatly in the left side. And then on the right side, it did kind of worsen a little bit because it looks better here as opposed to the image that was just taken. And then he stated that the lines were stable. So right here you see the ET tube. This is the ET tube, and proper placement of this tube is the distal tip is 2 to 3 inches above the carina. That is proper placement of the ET tube. And this is again to help with her breathing. And then this right here is the CV line, which we put into the, well, I didn't put it, they put it into the right subclavian vein, and these are used to administer any medication into the bloodstream. And then she also has a feeding tube that was inserted in down her throat. You can't really see it on the top, but you can see it on the bottom here. This little thin line, and it goes all the way into her stomach. That is the feeding tube. And as I stated, the radiologist reported that all the tubes and the lines were stable. So now we're going to talk about the treatment and follow-up. So unfortunately, the patient is still currently in the hospital due to her severe condition. She has to follow up with chest x-rays when needed. The ET tube that she had for her breathing was replaced with a tracheostomy tube. And the reason for this is because if an ET tube is left in for too long, the cuff that's on the ET tube can damage the tracheomucosa. So this can worsen the pneumonia, which we don't want for the patient. So they, at this hospital, which is Broward General Hospital, they only allow the ET tubes a minimum of 3 days in patients. And then that is when they replace the ET tubes with a tracheostomy tube to help with her breathing. Also, for the follow-up and treatment, she was to remain on the feeding tube and CV line. She was to continue taking her Legionnaires Disease medication, which is fluoroquinolones. Okay, and then I also took it upon myself to add a couple images. I decided to keep track with her progression after, and I added 2 extra images. So this is the one that was taken a year ago. This is the one that I included for the case study. And then these are the 2 extra images that I added right here. Again, all these are the left side, and this is the right side on all the x-rays. So as you can see, this within 1 year, there wasn't that much. She actually progressed a little bit. As we said earlier, she progressed in the left lung. And then I found it interesting that she drastically got worse. Look at all the white, which is all fluid in her lungs. This is all pleural effusion and fluid. you cannot barely even see her lungs. And then this was like 10 days after this image. This was February 10, this is February 20th. So as you can see, unfortunately, she's very bad right now. So she's still in the hospital. And then also, so I can show you now, this is the tracheostomy tube that was replaced. So over here, she has the ET tube, and now she has the tracheostomy tube in these images right here, in these recent images. So now we're gonna talk about the conclusion. So the patient was in a severe condition and the chest x-ray has shown improvement. The following x-rays, the new x-rays that I added just to keep up with her progress, unfortunately did show that she progressed drastically and she got worse. Also, sometimes a portable x-ray must be used according to the patient's condition, and also certain positions may need to be altered for the patient's benefit and comfort. As I spoke about earlier, we had to use a portable x-ray because she was unable to leave her bed due to the tubes. And we also had to alter the normal chest positions because the patient was unable to move much. And also concluding that Legionnaires' disease is a severe type of pneumonia, and a chest x-ray is extremely important in the diagnosis and progress of Legionnaires' disease. Thank you.